Concussions can happen in any sport at any level. The Concussion Recognition Tool 6, or CRT6, helps anyone identify the warning signs quickly and safely. The CRT6 released in 2023 by the Concussion in Sport group is a simple, validated tool for the recognition, not the diagnosis of concussion. It's meant for coaches, parents, teammates, and first responders to use on the sidelines.
That's it. Keep it moving.
The first step is to check for red flags. If the athlete shows any of these, like neck pain,
Is there any pain?
Yeah.
seizure, double vision, or loss of consciousness,
Open your eyes. Open up.
treat it as a medical emergency. Call emergency services immediately.
Can you move all your arms and legs for me? That one's kind of weak. Let's get you up.
Oh, my head, it really hurts.
Listen, let's just sit here for a second and no, we want to stay down for right now. We want to sit down and relax.
If red flags present and the athlete is wearing a helmet or protective gear, such as in football or hockey, do not remove it unless you are specifically trained to do so, or it's absolutely necessary to maintain an open airway. Improper removal can worsen a potential neck or spinal injury. Instead, stabilize the head and neck in the position found and wait for emergency medical personnel. If any red flag is present, or if you're unsure, call emergency services immediately. The athlete should not be moved until medical professionals arrive. If there are no red flags, observe the athlete's behavior. Concussion should be suspected if an athlete displays any signs or symptoms after an impact to the head or body. Are they unsteady?
Get you off the field. You good?
Slow to answer?
Cindy, you here?
Do they seem confused or vacant?
Where am I? What's going on?
These are clear signs of possible concussion. Ask how they feel. Common symptoms include headache, dizziness, nausea, or feeling in a fog. Remember, concussion symptoms don't always appear right away. They may develop minutes to hours after the impact. A player who seemed fine at first can worsen later. Also, symptoms may be present initially, then resolve only to recur hours later. As such, if there is a high suspicion for concussion, the player should not return to play even if symptoms are absent. CRT6 includes simple memory questions to test orientation and short-term recall. These are tailored to the sport context and can reveal subtle cognitive deficits.
Do you know where we're at today?
The park.
Yeah. Okay. What are we doing? What were you doing?
Soccer?
Okay. You know who scored last?
I don't know.
It's all right. It's all right. Well, what team did you play last week? Do you know that?
No.
All right. Did your team win the last game?
Yeah.
Cool. Good.
If a concussion is suspected, remove the player from play immediately. They should not return to play until evaluated by a qualified healthcare professional. Remember, when in doubt, sit them out. The CRT6 empowers anyone on the field to recognize concussion early and quickly. Download the tool using the link in the text description box, share it with your team, and help make sports safer for everyone.